what's your experience of treating patients with alcoholism?
So I've been a GP now for 30 years, and over that time, I've treated many patients with alcohol problems. In the early years, the involvement of the GP was much more substantial before the setup of drug and alcohol groups provided by the NHS. Drug and alcohol services, over the last few years, it's been a lot more difficult to access those services, and sometimes there's considerable delays in accessing those services. Originally, in the 1990s and in the early 20s, we would be able to do a detox at home using tablets that are available in general practice. But now, generally, drug and alcohol services recommend that they want to manage those issues, which makes it somewhat more difficult for patients. We always encourage them to access services through drug and alcohol, but I like to monitor those patients. It's a big issue, substantial problem. The alcohol will cause significant physical problems, significant mental health problems, significant social problems, marital problems, and patients can benefit from seeing their GPs for a lot of these issues, sometimes just for guidance and support. So it's a massive problem in our society, and the services that GPs provide are effective. Drug and alcohol is good in most instances. Patients' involvement with drug and alcohol will be good. Sometimes for patients, it may be just a respite, temporary respite, that for a few months they're not drinking, then they go back to their drinking habits. We've got Alcoholics Anonymous and other organizations that focus on alcoholism, but alcoholism is a big problem.
Do you find there's different stages of alcoholism? There's certain stages where this person's too far gone and we no longer can treat them as we would treat with someone who's just been taking the odd drink here or there.
I think what you're alluding to is this idea of we have functional alcoholics, so people who drink a lot and then they go to work. I think they're a scale of the same problem, and that we see the physical problems, and sometimes doing patients' blood tests, I'll pick up tests and I'll ask them, are you drinking heavily? And then they'll confess to drinking heavily. And some people will drink very heavily on weekends, some people will drink every evening. I think the level of drinking that's safe is zero, really. And from your question, I understand what you're alluding to. I don't think anyone's ever too far gone, because even if you can encourage them to stop drinking for a few months, which often you can with a little bit of help, that will give their body a little bit of a respite. There'll be some recovery of their liver function. There are alcoholics that take it to the next level where they drink so much that it's damaging their brains. And even in them, sometimes you get to a point where they've forgotten about alcohol. Although that's rare, it does happen sometimes, that they've done so much damage that they don't remember that they're alcoholics.
I do question where it comes from. Is it more of a hereditary thing? You see your father doing it, or you see someone in your family doing it, or is there something? What in your general practice do you think people just pick it up as they're going on, peer pressure maybe, or is it just something which is a social thing as well? It's quite common amongst your social crowd, and before you know it, you're hooked onto it.
I think there's many cultural issues, but there's family issues there as well. If your parents drink heavily, there's a higher chance that the children will drink heavily. I think it's a combination of many factors. Alcohol prices obviously have dropped a lot when alcohol is widely available, much more widely available now through supermarkets. You have pubs which are opening hours are extended, so it's widely available right through society. It's not seen as the evil that drugs is. So yes, there's social factors there as well. But I think it's definitely a combination of factors. We talk about the addictive gene, whether that really exists or not. But some people have a lot more problems with alcohol than other people. Some people can give up very quickly when they realize that they've got physical problems, and many patients can't.
Okay. And you mentioned alcohol services available. Sorry, that bit went a bit wrong. Even I have to cut that bit out. You mentioned about services which are available for help. Do you see people taking up that help? And again, what is the outflow from that?
I think once patients decide to come and see their GP, that's either they've decided themselves or their families encourage them to come and see the GP. And then it very much depends on that patient's motivation. If they're motivated to improve their situation, then they'll take up those services. Often you'll find patients' motivation for reducing alcohol consumption isn't that strong until they develop physical problems where they can see the damage that they've done. And sometimes the motivation may be marital problems, it may be family problems, it may be work problems, or you're caught drink driving or something like that. But the motivation is an issue with a drug like alcohol.
Going back a little bit, in your general practice, are you seeing a specific type of a group of people that are coming in? Is it more females, more males, more younger, older, or is it just throughout the whole range?
I'd say it's throughout the whole spectrum. In practice, I know that there's a particular issue amongst some of our Asian groups, which is particularly with young Punjabis, who some of them drink very heavily, and that's an issue which we try and educate them on when they're young to try not to go that way. But in the alcohol problem, we see it right through society. I've seen it in youngsters. I've seen it in 75, 80-year-olds as well.
You're talking about the Punjabi culture, and we're trying to educate them. Again, going back to what we said earlier on, it's something which I think we pick up hereditary. We see our parents doing it, we see our grandparents doing it, and when there's any social events, as you know, alcohol is readily available for us. Do you see the future getting any better with this, or is it just going to be as it remains? Because being on the planet for 40 odd years now, I've just seen it grown bigger and bigger.
Well, I think in our country here, some of the social habits have changed in that pop culture isn't the way it was 15, 20 years ago. And the younger generation, I'd say below the age of 21, they don't seem to be as interested in alcohol as much as the generation before them was. So perhaps there is a change. I hope there's a change, because in our generation we saw many young men die early, very early, some in their 40s. Of many people we've known passed away because of alcohol problems. So we're hoping that this next generation do understand the risks of alcohol, and we don't promote that drinking amongst them, especially at social functions as well.
You mentioned the younger generation not as interested. Could it be that they're interested in something else, or it's diversified to other areas maybe, or maybe they're just focused on health and well-being more now?
I think there's definitely more of a focus on health and well-being. They've seen the problems that alcohol causes within society, within their own families. But then if you look a bit deeper, they're taking perhaps more cannabis than our generation ever noticed or did. So I think there are changes there. They're not all good, but the alcohol reduction that we're seeing in that generation is definitely good.